Good afternoon and welcome to today's webinar, Engaging Veterans and VA Healthcare. It's about serving veterans in your dental sleep medicine practice. This webinar podcast will expand your dental sleep medicine practice by serving our nation's veterans. Veterans form a significant patient group with distinct healthcare needs, especially for sleep disorders. With millions of veterans enrolled in the VA healthcare system, and sleep apnea being a common service-connected disability, you can make a substantial impact. Your TDSS membership offers two key advantages. TDSS providers are contracted and credentialed in the Community Care Network, and TDSS resolves the challenge of filing claims that get paid. Today we'll focus on how to navigate the VA healthcare system and how to engage in your communities. The goal is to draw more veterans, including those with VA benefits and TRICARE coverage, to your practice. You'll gain practical knowledge to serve more veteran patients, leading to a thriving dental sleep medicine practice. I'd like to clarify a few things before we start. Veteran versus VA veteran. Not all veterans have VA benefits, nor do they all have TRICARE coverage. But the only way to identify those that have the VA benefits or TRICARE coverage is to reach out to the veteran community. Another is the term TDSS versus TDSS provider. TDSS handles the back office. It's the TDSS provider who engages in their communities so that the veterans get to know who they are and their why for providing this type of treatment. So now we're going to move on to the podcast itself. I hope you enjoy.
Welcome, glad you could join us. We're doing a deep dive today into something really important for veterans here in Texas, understanding how to get care for obstructive sleep apnea.
That's right. Specifically, we're looking at oral appliance therapy, or OAT, and how that fits into the VA healthcare system and the community care network.
And this matters to a lot of people. There are over 1.5 million veterans just here in Texas. So yeah, definitely relevant.
Absolutely. And the information we're drawing on today comes straight from a training manual that Texas Dental Sleep Services, or TDSS, developed for their own providers and staff.
And crucially, these TDSS providers, they're already credentialed within the VA Community Care Network.
Exactly. So they're part of the system we're discussing.
So our mission today is pretty clear. We want to give you a solid handle on how the VA system works for getting these oral appliance therapy referrals and how providers like those at TDSS actually connect with that system.
Because let's face it, navigating the VA, it can seem, well, complicated sometimes.
It really can. So we're aiming to, simplify the important parts, make it easier to see how it all connects for this specific therapy.
Makes sense. So maybe we should start with the big picture, the VA healthcare system itself.
Good idea. It's huge, right?
Oh, definitely. It's one of the largest healthcare systems in the U.S. Serves around, I think, 9 million enrolled veterans each year.
Wow. And that involves quite a few different kinds of places where veterans get care. The manual kind of breaks that down.
It does. You've got the VA medical centers, think large hospitals. They offer a whole range of services, inpatient, outpatient, specialized care, the works.
Okay, the big hubs.
Then there are the outpatient clinics. These are more focused on primary care, mental health, maybe some specialty services, but usually no overnight stays or emergency rooms.
Right, more day-to-day stuff.
And building on that, you have community-based outpatient clinics, or CBOCs, often smaller, set up in local communities to make primary and mental health care easier to access.
Especially for folks maybe further away from a big medical center, like in rural areas.
Precisely. Yeah. And finally, there are vet centers. These focus more on counseling, readjustment support after service, mental health, well-being, very community-focused and confidential.
Okay, so a whole network. How might that relate to getting, say, an oral appliance? Where would that journey typically start?
Well, a veteran might first bring up sleep issues at their local CBOC or with their primary care provider at an outpatient clinic. But the actual diagnosis and the referral for something specialized, like oral appliance therapy, that would likely involve a VA medical center specialist or a primary care provider who could then tap into that community care network.
Gotcha. And this whole system, it's organized regionally too, isn't it?
Yes, it's divided into 18 regional networks. They call them the VISNs, Veterans Integrated Service Networks.
And Texas.
Texas mostly falls under VISN 17, just helps to understand the structure.
Right. So if you, the listener, needed to find a specific VA location near you, what's the best way?
The training manual points to a really useful tool, the VA Facility Locator website. It's the go-to resource. And the manual actually includes a list of specific website addresses, URLs for quick access. Very handy. That sounds super practical. Okay, so let's connect this back to the Texas Dental Sleep Services providers. You mentioned they're part of the Community Care Network.
Yes, exactly. Being part of the CCN means they're approved to receive referrals directly from the VA for veterans needing oral appliance therapy.
And for those providers, working with TDSS has some advantages, right?
It does. A key thing is that TDSS actually handles a lot of the administrative legwork, the details of interacting with the VA systems. It really simplifies things for the individual provider.
So they can focus more on the patient care.
Pretty much. They also use a system called HealthShare Referral Manager, HSRM. That's the VA's platform for sending and managing referrals within the community care network. It's vital for coordination.
Okay, HSRM. Good to know that term. And I imagine staying up to date with VA and CCN rules is pretty important too. Oh, constantly. Protocols can change. So staying informed is key for everyone involved. TDSS, the providers, everyone.
Okay, so with all that context, let's get to the core process. A veteran thinks they have sleep apnea. They need help. How does the referral for an oral appliance actually happen?
Right, this is super important. The VA classifies oral appliance therapy as a medical treatment.
Not dental, even though it's an appliance for your mouth.
Correct. It's treated as medical. And that's a big deal because it means it falls under the VA's medical benefits package, which generally has broader eligibility than their separate dental benefits.
Ah, okay. That makes a difference.
And it's not just the VA deciding this on a whim. The official VA and DoD, that's Department of Defense Clinical Practice Guidelines, the 2025 ones, they actually recognize oral appliance therapy
Recognize it how?
as a first-line therapy option for mild to moderate obstructive sleep apnea, and also as a key alternative for any veteran, regardless of severity, who can't tolerate or doesn't want to use CPAP.
So it's an officially recommended treatment path.
Yes, based on evidence showing it works well, especially for adherence people sticking with the treatment when CPAP is maybe uncomfortable or difficult for them. Better adherence often means better long-term health.
Makes total sense. So walk us through the steps. How does a veteran get from, I think I need this, to actually getting the appliance?
Okay, it starts with a VA medical provider. This could be their regular primary care provider, or maybe a sleep specialist within the VA system.
And they do an evaluation.
Exactly. They'll do an evaluation to confirm obstructive sleep apnea and decide if an oral appliance is the right approach for that specific veteran.
And if they decide it is.
Then that VA provider submits a referral. They do this electronically through that system we mentioned, HSRM, the HealthShare Referral Manager.
And what does that referral look like?
It uses specific medical codes, CPT codes, like E0486 is the common one for the appliance itself. And it uses a specific VA designation called a Standard Episode of Care, or SEOC. The one for this is clearly labeled Oral Appliance or Mandibular Repositioning Device for OSA.
Okay, very specific. So just to be crystal clear, a veteran can't just call up a TDSS provider directly and say, I need an oral appliance, bill the VA.
Absolutely not. That VA authorization, that referral through HSRM, is essential. It has to originate from within the VA medical system. No self-referrals work here.
Right. The VA doctor is the gatekeeper, so to speak.
In a way, yes. They initiate the process based on medical need.
Okay. Now, the manual seems to really highlight the importance of TDSS providers connecting with VA primary care providers specifically. Why is that relationship so crucial?
Well, think about who's usually the first person a veteran talks to about a health issue.
Probably their primary care doc.
Exactly. They're the front line.
Yep.
So if those primary care providers know about oral appliance therapy, understand it's a covered option through the community care network, and know how to refer for it, well, that dramatically increases the chances that veterans who could benefit will actually get access.
So it's about awareness at that key point of contact. Are there challenges in getting that information to them?
Sure. VA primary care providers are busy. They deal with a huge range of issues. Just making sure they're aware of the latest guidelines for sleep apnea, the specifics of oral appliance therapy, and the referral pathway through HSRM that takes effort. Keeping them updated is a challenge.
So what do providers, like those with TDSS, do to bridge that gap? How did they reach out?
They use different tools, things like introduction letters explaining who they are and what they offer. They provide educational handouts, importantly, ones that reference those official VA and DoD guidelines we mentioned.
Using the VA's own guidelines to support the option. Smart.
Definitely. And the manual even gives them talking points for when they meet with primary care providers. The focus is often on presenting oral appliance therapy as a practical solution, especially, for those veterans struggling with CPAP.
So proactive education is a big part of it.
A huge part. It helps make sure everyone's on the same page about the options available.
Okay, let's pivot now to the veteran's perspective. We've talked about needing a VA referral, but what about their rights when it comes to using the community care network, maybe choosing a provider like TDSS?
Yeah, this is really important for veterans to understand. The community care network exists precisely to give eligible veterans access to care in the community when the VA itself can't provide it within certain standards.
Standards related to what?
Primarily, wait times for appointments and drive times to get to a VA facility. These are key eligibility triggers for community care.
Okay, can you break down those standards? What are the thresholds?
Sure. So for primary care or mental health, if a veteran has to wait more than 20 days for an appointment, or if the nearest VA facility that offers the care is more than a 30-minute drive away, they might be eligible for community care.
20 days wait or 30 minutes drive for primary mental health.
Got it. What about specialty care, like getting an oral appliance?
For specialty care, the standards are a bit different. The wait time standard is 28 days. So if you can't get a VA appointment within 28 days, you might qualify for community care.
Right. Or the drive time standard for specialty care is 60 minutes. More than a 60-minute drive to the nearest VA specialist, that's another trigger.
Okay, 28 days wait or a 60-minute drive for specialty care. So if the VA can't meet those, the veteran has a right to ask for community care.
That's exactly what the manual emphasizes. Veterans have the right to request community care if those standards aren't met.
And if they are eligible for community care, do they get any say in where they go? Can they ask for a TDSS provider?
Generally, yes. If a veteran qualifies for community care, they usually have the right to choose a provider from the community care network list, assuming that provider offers the needed service. So yes, they could request a referral specifically to a TDSS provider if they're in the network and convenient for the veteran.
But they still need that initial VA referral to get the ball rolling.
Always. The referral is step one. But knowing these rights empowers veterans to have a conversation about where they receive that referred care, especially if getting to a VA facility is difficult or involves long waits.
That is empowering. Do you have examples, maybe from the manual, of how a veteran could phrase that request to their VA doctor?
Yeah, the manual offers some practical language. A veteran could say something like, "Doctor, I've learned about oral appliance therapy for my sleep apnea, and I see it's covered through community care. I know Texas Dental Sleep Services is in the network near me. Could I get a referral to see them for this?"
That sounds pretty clear and direct. Is there anything like a cheat sheet for veterans on this?
There is. The manual actually includes a handout specifically for veterans called How to Request a VA Referral for Oral Appliance Therapy. It gives them steps and talking points.
Well, that's fantastic.
Yeah, and it also tackles common questions veterans might have. Like it reinforces that, yes, the VA covers it if you have the referral, but no, you can't just schedule it yourself first. It clarifies those common points of confusion.
Are there typical hurdles veterans face even when they know these rights?
Sometimes the challenge can still be ensuring their VA provider is fully up to speed on oral appliance therapy as an option and knows the specific HSRM referral process for it, which loops back to why that provider education piece we discussed is so ongoing and important.
It all connects. Wow. Okay, this has been incredibly informative, really breaking down what can seem like a maze. Let's try and crystallize the main takeaways for everyone listening.
Okay. I'd say takeaway number one, oral appliance therapy for sleep apnea. It is a VA-covered medical treatment.
Good. Point two.
It's accessible through the community care network for eligible veterans, meaning you might be able to see a provider like TDSS in your local community.
But, and this is key point three,
You absolutely need that referral first. It has to come from a VA medical provider through the HSRM system. No shortcuts there.
and point four, understanding your rights is crucial.
Definitely. Know those wait time and drive time standards for community care eligibility. It helps you advocate for yourself if needed. 20 days, 30 mins for primary, 20 days, 60 mins for specialty.
And providers like Texas Dental Sleep Services, they're actively working within this system, right?
Exactly. They're part of the network. They educate VA providers. They use the HSRM system they're working to make this option available and smooth the process for veterans needing this care in Texas.
So listening to all this, it really makes you think, doesn't it? How could this knowledge, this understanding, actually empower you, or maybe a veteran, to take the next step to really explore better sleep health options available through the VA?
That's the hope, isn't it? That being informed allows veterans to have more productive conversations with their providers, to ask about all the options, including oral appliance therapy. And if someone wants to dig deeper, checking out that VA facility locator website is a great start to see what's nearby.
And maybe connecting with local veteran groups, too. They often have great insights and support for navigating the system.
Absolutely. Local VSOs and other groups can be invaluable resources.
Well, that was the end of part one, and we're now going to move on to part two of this podcast.
Welcome back to the Deep Dive. We're picking up right where we left off, digging into part two of engaging the veteran community and healthcare system.
That's right. And today, our focus is really sharp: how healthcare providers, especially those working with Texas Dental Sleep Services, can, really connect veterans to the sleep apnea care they need, specifically oral appliance therapy.
Exactly. It's about bridging that gap. So this part of the training seems very action-oriented for the providers and their staff.
It really is. It lays out practical steps, things they can actually do to make sure veterans know about and can access this treatment option.
Okay, so part two covers three main areas, these modules. Let's quickly outline those.
We can. First up is Module 5. That's all about connecting directly with veterans out in the community.
Okay.
Then Module 6 looks inward, how to engage veterans who are already patients in the practice.
Right, identifying them.
And finally, Module 7, which is so important, understanding veteran rights when it comes to the community care network.
Got it. So our mission here is to really pull out those concrete strategies. What can a Texas dental sleep services provider, or maybe their front desk staff, do like tomorrow to better serve veterans with sleep apnea? Let's dive into Module 5. Hitting the pavement, connecting directly. What's the core idea?
The core idea is proactive community outreach. It's about Texas Dental Sleep Services providers and their teams getting out there, raising awareness.
Awareness about sleep apnea itself and also the treatment.
Exactly. That sleep apnea is common and that oral appliance therapy is actually a covered benefit through the VA. The goal is to really equip these providers to talk confidently with veterans, become trusted allies.
Makes sense. So if a provider is thinking, okay, I want to do this, where do they even start looking for these local veteran groups?
Well, the training points to some pretty common places veterans gather. You've got organizations like the VFW posts, American Legion posts, AMVETS chapters. Those are key.
The established ones.
Right. And also look for local veteran alliances like Combined Arms if it's in their area, community health fairs, veteran expos. These events draw a lot of veterans.
And finding them. Is it just a Google search away?
Often, yeah. Simple searches like American Legion near me on Google Maps work great. The training also mentions checking out online spaces like Reddit's Our Veterans or maybe local Facebook groups.
Okay.
And don't forget the local VA's patient advocate department. They usually have a good pulse on what's happening in the community.
All right. So a provider finds a group, maybe a VFW meeting.
Mm-hmm.
How do they talk about this? What kind of messaging works best with veterans? This feels really important to get right.
It is critical. The language has to be respectful, empowering. Think, we're here to serve those who served. It builds that immediate rapport.
Not pity, but service.
Exactly. And a huge point, be mindful of triggers. No combat imagery, absolutely none. The focus needs to be positive. Better sleep quality, safety, just general wellness.
All right, focus on the solution, the benefit. So what are those core must-have messages a Texas Dental Sleep Services provider needs to get across?
3 key things. Number 1, oral appliance therapy is a VA-covered treatment for sleep apnea. That's huge.
Okay, the coverage.
Number 2, the simplicity. No masks, no machines, just better sleep. Appeal to the comfort aspect.
Yeah, that resonates.
And 3rd, the action. You may be eligible through your VA doctor. Make it clear how they can pursue it. Direct, simple, relevant.
Okay, messages are clear. How do they actually deliver them? What are the practical ways to engage these groups?
Well, offering to do a short presentation at a meeting is a great way. Or set up an educational table at an event. Keep it informative, not a sales pitch.
What kind of topics work well for a presentation?
Things like, what is sleep apnea? How does it show up in veterans specifically? Explaining that CPAP isn't the only game in town. And crucially, how to actually ask their VA doctor about getting an oral appliance.
And introducing themselves, of course.
Yes, introducing the Texas Dental Sleep Services practice and explaining their role as a community care network provider.
If a provider is going to an event, setting up that table, what should they absolutely bring? Like a checklist.
Definitely need a checklist, a portable table, obviously, a clear sign practice name, Texas Dental Sleep Services affiliation, veteran-friendly handouts, easy to read.
And you mentioned a sample device.
Oh yeah, a sample oral appliance. It makes it real, tangible, let them see it, touch it. Also, a simple contact sheet to collect info from interested folks.
For follow-up.
Exactly. And super important, a handout that spells out the VA referral pathway, like step-by-step instructions for talking to their VA doc. And the training mentions Texas Dental Sleep Services actually provides a lot of this: videos, slides, handouts. You don't have to create it all from scratch.
That's helpful. So the event ends.
Right.
What happens next? How does a provider build actual trust, not just make a one-off appearance?
Follow-up is key. Thank you notes to organizers, for sure. Then calls or emails with permission to veterans who showed interest. Answer their questions.
Keep the conversation going.
Right. Share materials if people couldn't make it. And for the long haul. Attend their regular meetings sometimes. Maybe sponsor a small part of an event. Offer free screenings or Q&A sessions periodically. It's about being a consistent, reliable presence.
Building that relationship. Now, the training mentions specific tools too, like scripts. Any examples stand out for Texas Dental Sleep Services providers?
Yeah, there's a great script for calling, say, a VFW post commander. It's concise, respectful, something like, "Hi, my name is Naim with Texas Dental Sleep Services. We're contracted with the VA for oral appliance therapy for veterans with sleep apnea. Could I maybe come speak briefly to your members? We'll keep it short, informative, bring everything needed. Is there a good time in the next month or two?"
Simple, direct, offers value. I like it. And there was a flyer mentioned too, specifically for veterans.
Yes, a specific flyer they can request from Texas Dental Sleep Services. Good for display boards, good to hand out, reinforces those main points visually.
Okay, so the big picture for Module 5. Veterans trust sources within their own community. So for Texas Dental Sleep Services providers, getting out there, engaging directly, respectfully, that builds awareness, trust, and ultimately helps veterans get referred for care.
You nailed it. It's about becoming a familiar, trusted resource.
All right, let's shift gears then. Module 6, identifying and engaging veterans who are already patients in a Texas Dental Sleep Services provider's practice. This seems like low-hanging fruit in a way.
It really can be. The goal here is for the entire team at the Texas Dental Sleep Services practice providers, hygienists, front office staff to get better at recognizing veterans among their patients.
Or even family members of patients.
Exactly. And then proactively letting them know about oral appliance therapy being a covered VA benefit. It's about weaving this awareness into the practice's everyday routine.
So step 1 is just finding out who's a veteran. How does the training suggest doing that?
It starts right at intake. Add a simple, direct question to the forms for new and existing patients. Are you a U.S. military veteran, or do you have a close family member who is a veteran?
That covers both bases, encourages self-ID, and also might reach veterans through family.
Precisely. It opens the door for a conversation.
And if someone says, "Yes, I am," or "My spouse is," what should the staff at the Texas Dental Sleep Services practice say next?
The suggested prompt is pretty straightforward. If you're a veteran, we may be able to help you access a VA-covered treatment for sleep apnea through your VA doctor. It's low pressure, just informative.
But it's not just about asking the question, right? The whole team needs to be ready for the answer.
Absolutely. Training is essential. The front office, the clinical team, everyone needs to know how to ask sensitively, recognize possible sleep apnea symptoms, understand the basics of VA referrals, and know who in the practice to direct the patient to for more details.
Like the provider themselves, or maybe a treatment coordinator.
Exactly. And the training suggests things like cheat sheets or mini scripts for the staff, which just helps ensure everyone's giving consistent, accurate info.
What about the office environment itself? How can a Texas Dental Sleep Services practice signal that they're veteran-aware, veteran-friendly?
Visuals help. Using some subtle, patriotic-themed materials, putting up those flyers and posters we talked about. Are you a veteran? Ask about a VA-covered CPAP alternative. Or, proud to serve veterans, ask how we can help. Put them at check-in, check-out, maybe in the consult rooms.
Makes it visible, normalizes the conversation. But what about online? Website, social media?
Crucial nowadays. Providers should update their websites, their social media bios, state clearly, "We are proud to serve veterans. VA authorized provider for oral appliance therapy." Maybe add an FAQ section specifically for veterans about talking to their VO doctor.
Makes the information accessible 24/7. What about the appointment process itself? Any suggestions there for Texas Dental Sleep Services providers?
Yeah, making it smoother for veterans. Maybe designate one staff member as the main point person for veteran inquiries, offer virtual consults just to discuss the process, and importantly, make sure they keep appointment slots available to accommodate those VA and TriWest referrals when they come in.
Show they're ready and willing to accept them. Module 6 also had specific marketing tools mentioned.
It did. There's artwork available for an in-office poster, which they can request, and there's a sample email or text message campaign specifically for veterans.
Oh, what does that look like?
The subject line could be something like, "Veterans, a covered treatment option may be available." And the message body would briefly explain that the practice is a credentialed community care network provider, oral appliances covered, hit those key benefits, no mask, no machine, just better sleep, covered by VA medical benefits, and tell them who to talk to or call for more info.
Very direct. So, the takeaway for Texas Dental Sleep Services providers from Module 6 is, look within your own practice. Simple, proactive steps, asking the question, training the team, using visible cues, can uncover many veterans who might qualify for covered oral appliance therapy.
That's exactly it. It's about creating that supportive environment right there in the practice, making it easy for veterans to explore their benefits.
Which brings us perfectly to Module 7. This feels like the linchpin for Texas Dental Sleep Services providers, understanding veteran rights within the community care network. Because knowing about the therapy is one thing, but knowing how to get the VA to cover it is another.
You said it, linchpin. Modules 5 and 6 are about finding and informing veterans. Module 7 gives the Texas Dental Sleep Services provider the knowledge to actually help them navigate the system to get that care. Without this piece, veterans can get stuck even if they're interested.
Right, so first things first. When does a veteran actually qualify for community care? It's not automatic for everyone, is it?
No, it's based on specific conditions. Like, if the VA can't provide the service needed, or there's a grandfather rule about distance, sometimes the VA provider and veteran just agree it's best. Or if a VA service line isn't up to snuff, quality-wise.
Oh.
But often, the most practical reasons are the wait time and drive time standards. If the VA can't provide the care within certain timeframes or distances,
The wait times. What are those standards specifically for something like oral appliance therapy, which is specialty care? Texas Dental Sleep Services providers need to know these numbers.
they do. For specialty care, like oral appliance therapy, the standard is typically having to wait more than 28 days for an appointment, or having to drive more than 60 minutes to the VA facility offering it.
28 days or 60 minutes.
Right. And the training points out, realistically, many veterans do face waits or drives longer than that, especially for specialized care.
So, what should a Texas Dental Sleep Services provider advise a veteran to ask their VA provider based on these standards?
Encourage them to ask directly. Will I be seen within the VA's required 28-day wait time or 60-minute drive time for this oral appliance therapy? If the answer is likely no, then the veteran has the right to request community care.
And the VA should then facilitate that.
Generally, yes, if they meet those criteria.
Okay, so the veteran is eligible. Can they just pick any dentist for their oral appliance?
Not quite. They can choose between the VA or a provider in the community care network. So they can't just go anywhere. But, and this is key for Texas Dental Sleep Services providers, the veteran can request a specific in-network provider.
So they can specifically ask for a Texas Dental Sleep Services practice if it's in the network.
Yes. The provider should encourage the veteran to say something like, "I'd like to be referred to Texas Dental Sleep Services. They are my preferred community care network provider for oral appliance therapy."
Clear and specific.
Yeah.
But they still need the VA authorization first, right? No self-referrals?
Absolutely. The VA has to approve and send the referral. No shortcuts there.
So what's the Texas Dental Sleep Services provider's role in all this? Are they just waiting for the referral?
No, they play an active role in education and guidance. They need to explain these eligibility rules to veterans, let them know, yes, our practice is part of the community care network. We can accept your referral.
Maybe give them something tangible.
Exactly. A printed handout or an email with clear instructions is perfect. Something like, talk to your VA doctor. Tell them you want oral appliance therapy for sleep apnea. Ask them to refer you to a community care network provider using the HealthShare Referral Manager.
Okay, HealthShare Referral Manager, HSRM, that's the VA system they use.
Yes, that's the VA's electronic system for managing these community care referrals. The Texas Dental Sleep Services provider won't use HSRM directly, but knowing the name helps them guide the veteran on what to ask for at the VA.
And the training had a tip about a referral card.
Yeah, a great little tip. Give the veteran a small card to take to their VA appointment. It should have the Texas Dental Sleep Services practice name, state they're a CCN provider, summarize the referral request steps, and include the practice's contact info for scheduling after the VA sends the OK.
Super practical.
Yeah.
The training also listed common veteran questions and answers. Can you give an example? That seems really useful for the front desk or anyone interacting with veterans at a Texas Dental Sleep Services practice.
Sure. A really common one is, can I just schedule with you directly? The answer needs to be, unfortunately, no. The VA has to authorize it first through their referral system. But I can tell you exactly what to ask your VA doctor to get that started.
Managing expectations, but offering help.
Right. Or, will the VA really cover this? Answer, yes, oral appliance therapy is a covered VA medical benefit, and we are credentialed providers in their community care network.
Reassurance.
And maybe, what if my VA doctor doesn't know about this? Response, that can happen. You can give them our info or this flyer. We're also happy to talk to their team if needed.
Proactive support. And there's a specific handout for this referral process, too.
Yes, Module 7 mentions a handout called How to Get a VA Referral for Oral Appliance Therapy. Step-by-step instructions the veteran can take right to their VA appointment.
Fantastic. So Module 7 really empowers the Texas Dental Sleep Services provider. They become a key guide, helping veterans understand their rights under the Community Care Network and navigate that referral process to actually get the care.
Exactly. Knowledge is power here. For both the provider and the veteran, it connects the need with the solution.
Before we wrap up, let's quickly mention the appendices in the training manual. They seem packed with resources for Texas Dental Sleep Services providers.
They really are. Appendix A is straightforward. It's the quiz answer key for all the module quizzes. Good for checking understanding.
Useful for self-assessment. And Appendix B sounds like the toolbox.
It basically is. Appendix B is the list of marketing materials referenced in the training manual. It catalogs everything, all the scripts, templates, flyers mentioned.
Organized how?
It's broken down logically. Sections like general outreach and VA engagement, that's where you find the provider introduction letter template, the veteran referral request card idea. Then community outreach materials lists the veteran-facing flyer presentation outlines.
Okay.
In-practice engagement tools has that veteran intake question, the poster artwork. And patient education support includes that crucial handout, how to request a VA referral for oral appliance, plus FAQs. It's all laid out for the Texas Dental Sleep Services provider.
A really practical compilation. And Appendix C, what's in there?
Appendix C is the VA contact directory and provider resources in Texas. Super valuable. It has links to find VA facilities across Texas, helps locate specific VA primary care providers or VA sleep specialists. Great for coordination, both for the Texas Dental Sleep Services practice and for the veteran trying to navigate the VA system.
Excellent. So pulling it all together from this deep dive into Part 2, it's clear that it takes proactive effort from individual Texas Dental Sleep Services providers and their teams. It's not just about the organization, it's about the people on the ground.
Absolutely. That engagement, both out in the community and within the practice walls, combined with really understanding veteran rights in the community care network, that's what makes the difference. That's how Texas Dental Sleep Services providers can truly bridge the gap for veterans needing oral appliance therapy.
Which brings us to our final thought for you, our listener. Think about the real difference it makes in a veteran's life when their healthcare provider, like a Texas Dental Sleep Services provider, is truly equipped with the knowledge, the tools, the empathy to guide them effectively toward the care they've earned. Consider how these steps we've discussed, the community talks, the simple question on an intake form, explaining CCN rights clearly, how these consistent, seemingly small efforts can add up. They can lead to real significant improvements in a veteran's sleep, their health, their overall well-being. It's about ensuring those who served get the restful nights they need and absolutely deserve.
Well, that was the end of part 1 and we're now going to move on to part 2 of this podcast. Well, that was the end of part 1, and we're now going to move on to part 2 of this podcast.